6 Valley hospitals waiting in anticipation for receiving Pfizer's vaccine, with plans to begin administering already in place.
That's right. Channel 5's Christian Colon takes a closer look at what DHR Health has in store once those vaccines get here.
DHR Health officials hoping Pfizer's vaccines reach their doorstep as soon as possible.
You know, we're excited about getting the vaccine down here in South Texas where it's so needed. Everybody needs it, but we think that we're particularly prone to disease.
State health officials say DHR Health will get about 5,850 doses of vaccines. Robert Martinez, chief medical officer, hoping met the people first in line are frontline doctors, nurses, and technicians. After that, non-clinical staff could also be vaccinated in this first phase. The vaccine stored in their freezer at about -80 degrees Celsius and with a relatively short lifespan once it's removed.
After it's out of the freezer, you have to mix it with saline solution before administration. Once you constitute it with saline, you have 6 hours. Otherwise, it goes bad.
Because timing is crucial, DHR Health is planning a mass vaccination event. In an assembly line, workers will start at an information station to collect state and federal data. After that, the injection.
Then those folks will move on to another station where they have to be watched for about 15 minutes for any side effects.
Side effects, Martinez says, are common in any vaccine according to the latest research data.
So a little redness at the injection site, maybe a little body ache, maybe a little headache, but then going away. So just all normal vaccine side effects, I would say, but certainly nothing significant.
After those 15 minutes, people will be cleared to go home and come back in about 21 days for their next dose. Martinez says the federal government will hopefully send those on a later date.
Channel 5 News asked Martinez whether the Valley will receive enough vaccines considering the limits and allocation that came with the COVID-19 drug remdesivir.
People realize this is a hot spot from here to Laredo, Brownsville, and so I don't think we're going to be shorted. Certainly that's the plan. The plan looks like it's going to be good, and we're going to have sufficient. But until I have it in my hand and it continues to come, I can't say for sure, but I'm hopeful.
Martinez believes the federal and state officials understand the needs of the Valley more this time around. Christian Colon, Channel 5 News.
Starr County, along with many other rural areas, will